4. I assume Commissioner Farr will be joining us any minute. We are here for a work session in the matter of providing updates to the board on the impacts of the Paid Leave Oregon program. And we have several folks from staff with us, so I'm going to turn it over to our Human Resources Director, Alana Holmes, to kick us off, and then she can introduce staff presentation as the time comes. Thank you and good morning.
Good morning, Chair, Commissioners. Thank you for the time this morning for us to provide you with an update on Paid Leave Oregon. We do have several members of our team at the table. Does not include the larger project team, and we also have some folks ready to support us here in the audience. So with me today is James Trujillo, who is our Workforce Wellness Manager, who will be providing the majority of the presentation. Sherry, who is also part of the Workforce Wellness Division and over the Leaves program. And then obviously Christine Moody, who is our Budget Manager and is available for questions that might come up in the discussion as well. And so at this point, I'll turn it over to you.
Thank you, Alana. Good morning, Chair, Commissioners. Thank you for this opportunity to give you this update on the Paid Leave Oregon program. So this does represent a team effort of staff across all divisions of, many divisions of the county, including legal, payroll, HR, of course, as we have worked through the Paid Leave Oregon program. So we are striving to provide you with as much accurate information as possible around our experience with Paid Leave Oregon. That includes employee experience and the experiences of peer organizations and our own experience administering the program for the county. So a couple of other notes that I would provide to you before we move on to the next slide is that, we believe that we are really aligned in the purpose of this program to provide us with a great benefit for paid leave for staff. We also believe that we're aligned on the results that we're striving for this program so that people are able to take care of their needs, their medical needs, their needs of their family, and to take care of themselves through paid leave. However, we have had difficulty in being aligned around the method of delivery of this benefit. One final note on benefits that helps shape my thinking around benefits and what's most important is that, in my view, the highest value benefits are those that contribute to the well-being of the individual and the organization, those that are being utilized across the organization, those that provide the best service for the cost and also represent an efficient use of our limited financial resources as an organization. Next slide, please. So I wanted to provide you with a little bit of historical context for those of you that perhaps are newer to the Paid Leave Oregon conversation. And first we want to recognize the valuable contributions made by Chair Trieger in her tenure with the Oregon Legislature. This is an important landmark bill for the state of Oregon. So this law was initially passed by the Oregon Legislature in 2019, which set the program in motion for policy building, process, systems, and staffing. In the fall of 2022, staff recommended that the county move to an equivalent plan to provide one unified leave service benefit for Lane County employees. Later that same year, the board elected to have the state administer the county's plan. Bargaining began for the contribution portion of the PLO program, along with a lot of other work that staff was working on to implement this program. In early 2023, the county began contributing both the employer and the employee contribution to the PLO program. And in the spring of 2023, the county moved to a new leave administrator for our OFLA and FEMLA leaves. That's notable that the standard, we did move to them to help enhance services around other leave services. So not directly related to PLO, but is an important provider for our leaves programs. Through 2023, the county worked diligently to put in policies, processes, training, and communication to staff across the county. The program went live in 2023, and today we're providing you with an update as promised in late 2022 to give you a sense of how PLO has been working.
I'm just going to stop for a second because I'm channeling what I've heard from some of you. So Paid Leave Oregon, you may hear referred to as PLO, That's the acronym. James also just talked about FMLA and OFLA. And for all of you in the audience that may be listening, that means the Family Medical Leave Act and the Oregon Family Leave Act. We're trying to make sure people make those connections.
Thank you for that, Alana. And
Thank you.
just
Thank you,
also so
Alana.
folks know, those are unpaid. The FMLA and OFLA are unpaid leave.
Unless you have your own leave to contribute to those. Yes.
Yeah, thank you very much. Next slide, please. Okay, so wanted to give you a sense of how we've collected this data and what we're going to be sharing with you. So we'll acknowledge that our data is not perfect. We don't have a lot of time that we have had since the program has gone live. So it's not perfect data. However, we have done our best to collect information from peer organizations. There's about 14 different organizations we've been in conversation with, and they've given us different levels of data. We've also had dozens of employee emails, phone calls, and face-to-face conversations regarding their experience. We've surveyed employees and collected their experience as well. We have received feedback through the Standard, who offers us leave administration support, and we've also received feedback from USI, who is our benefit broker. We also pay attention to the ongoing news coverage with Paid Leave Oregon, attended numerous legal webinars and BOLI training in order to collect all the information that we could about Paid Leave Oregon. So this analysis I'll be sharing with you is based on data collected between September and mid-December, roughly, of 2023.
We haven't had enough glitches for one morning, so we've got one more.
Oh, shoot.
While we're on pause, I will just offer, I appreciate the acknowledgement of my work, but it was as an advocate with a statewide organization and not in the legislature.
Okay.
Thank you.
I'm
There is only one member of this board who has served a year in the state legislature, and it is not me.
Okay, I'm sorry.
On purpose. No, that's
Sorry.
fine. I appreciate the acknowledgement. Thank you.
But you were heavily involved in the drafting of the language that was ultimately presented and passed by the legislature. Well, I think you just heard us so much refer to her work on this. Yeah.
Yes, does it need to be on speaker? Does Neil? Diana's lost audio in the room. He's looking at me. Okay. I can. Hold on. Okay, Diana wants to do a sound check. She's merged calls, so if someone other than me would say something so she can see if she's...
Test, check.
How's that, Diana?
I'm only hearing it through the phone. Neil's calling me. Can you recess for a moment?
Absolutely.
Again, please?
Thank you.
Thank you.
We will recess until I get the thumbs up from Neil Moyer. You have to.
I don't know the password. I don't know the password. Who knows the password? Judy? Okay, let me... Of course, Greg is saying he can hear us.
when I see Neil back up in the booth, give the thumbs up. Okay, we are reconvened. Thank you, everyone, for your patience with the technical challenges, and we will pick back up where we left off with the staff presentation on paid leave Oregon.
All right, thank you. Next slide, please. Okay, this slide represents just an overall picture of paid leave Oregon claims through mid-December of 2023. So what you see here in the blue bars is the top bar is the total claims, which represents a sum of the active claims and closed claims for that time period. Also note that at the time that we did this slide and reviewed the data, we had 15 pending claims, 13 denied claims, 9 fraudulent claims, and 9 canceled claims. And what I will note here, what is meant by fraudulent claims, just in case that is not clear, this represents 9 employees that contacted our program, our HR Leaves program, indicating they had received notification that they had applied for leaves through the state, but they had not applied through leaves to the state. So someone was fraudulently using their information to try to access leaves. Next slide, please. In this slide, we wanted to share with you what our county comparator organizations and other similar organizations are doing with Paid Leave Oregon, how many of them are working with the state, how many of them have an equivalent plan, and how many have in-house administration. So of the 14 organizations that we've been in contact with around this, 6 have elected to work with the state. That's that blue bar. And 8 have elected to have an equivalent plan. There have been no organizations that have elected to take this benefit plan in-house because my thoughts on that is just it's extremely complicated patchwork of leaves that organizations have to work with, and so it's very difficult to take something like this in-house. I also make one other note is that I'm going to use that green and blue scheme for more data sets. So whenever you see the green, that is representing equivalent plans. The blue is representing the state plans.
Question, are we one of the 6 or are these other than us?
Yeah, we did include Lane County in our data sets. Yep, thank you. Okay, next slide, please. So I mentioned to you earlier that we did survey a number of similar organizations. There were 7 organizations that responded, including Lane County. So Lane County is organization number 1. So the other organizations requested anonymity through the survey process, but we're okay with us sharing this information in a public setting like this. So just to orient you to what we're seeing on this slide, so for organization 1, which is Lane County, what you see there in that blue bar is the total employees that are eligible for Paid Leave Oregon. So it's 2,159 employees. That is larger than our standard head count for FTEs because Paid Leave Oregon, of course, is more expansive and it's available to more staff, staff such as Extra Help, etc., those that have joined the organization recently. The orange bar represents the number of claims at the time that we put this slide together, and that percentage represents the percent of the population that has taken advantage of the leave. And so you can see where Lane County is compared to many of these other organizations in terms of their employees, the percent that have taken advantage of the leave, and those that have used the leave at the time that we did the survey. Next slide, please. One of the questions that we asked of all the organizations, and because we wanted to have a better sense of our experience compared to other organizations, is around the timeliness of leave approvals. And so we asked the question, have your employees experienced delays in approval of leave? And so again, we broke this out between those that are working with the state as an administered paid leave benefit and those that had a third-party administrator equivalent plan. And so that is in the green. The blue is the state PLO plan. So for that question, all the organizations that responded said that that we're working with the state have experienced delays in approvals for the leave program. Those that had a third-party administrator, 75% of them said no, they had not experienced any delays, and about 25% were unsure.
Do you want questions as we go, or?
Sure.
I do, and this may be coming. Do you know how this compares with delayed approvals for other leaves and health benefits? I mean, we've all experienced delays in various, approval for health care coverage insurance. Do we have a sense of how this compares?
Well, what I can say is we work with the standard for all of our other leaves right now, and we meet with them weekly and have visibility into any issues that come up, and we resolve them as quickly as possible. And I don't believe that we've had any delays with outside of there are times when employees, they're required to gather certain data sets in order to provide certification from medical professionals, et cetera, that are outside of the control of the administrator. But I don't know that there's any delays that we've experienced through the standard as a result of issues with the standard itself.
If I may, if at the end of today we're asked to come back in February, we can certainly gather some information regarding those other leaves, Chair, that you've requested. And I would say specifically what we do hear a lot, and it's a challenge for employees, is especially with the way medical providers are set up nowadays, is having them take the time to fill out the paperwork that's needed for the programs. And especially because a lot of them now charge, additional just to fill out paperwork. So that is a complicating factor at times.
Thank you.
Okay, next slide, please. So another question that we asked of peer organizations as we were experiencing this issue ourselves is, have your employees experienced delays in receiving PLO payments or paid leave Oregon payments? And here we have kind of a mixed bag for those that are working with the state, the PLO state program. It's about a third and a third and a third. A third said yes, they were experiencing that. A third said no, and a third said they were unsure. For third-party administrators, majority, 50%, said no, they had not had any problems with payments. 25% said yes, and 25% were unsure. And so our experience as a county is we have definitely experienced delays for employees to get their payments. Next slide, please. So another question that we asked is around the employee experience receiving customer service through the administrator. So for those that are working with the state program, majority, 67%, said yes, they have had difficulty reaching the administrator. For the third-party administrator, 100% said unsure. My experience working with benefits is usually when there is a problem contacting some sort of a vendor, you generally hear about that. So that's anecdotal. So we're unsure based upon what we're seeing here from the data from these other organizations. But we do know that there have been problems getting a hold of as program administrators ourselves, as the employer, and sponsor, we attempt to contact the state PLO program on a regular basis. Unfortunately, what we have experienced is an inability to get through. I myself have tried to call them a number of times and received a busy signal, unable to get through. Most recently, we have heard from employees that have attempted to contact over a week's period and received busy signals the entire time and unable to get through to the state's program. In fact, our administrators have been on hold for multiple hours to try to get a hold of someone with the state to get some answers. Finally reached someone with the office that asked the question, what is Paid Leave Oregon? So we've definitely had some issues getting a hold of the program administrators for the state, and it's been a significant issue, especially when you have people that are dealing with very difficult situations for themselves or their family members. It's very challenging, and they will try to contact us to see if we can help them, and unfortunately we cannot. We have no direct line to the state program, and they're not able to, we have no influence in order to make changes or to get any information. Next slide, please. Another question that we asked is, have your employees received incorrect or inconsistent guidance from your administrator? So here again, for the state program, majority have said yes, they have received incorrect or inconsistent guidance from the state's program. For the TPA equivalent, there have been some 25% that also received some incorrect guidance. 50% said no, 25% were unsure. In conversations with other organizations, even with the third-party administrator equivalent plans, what I have heard from those organizations is that the root cause of the inconsistent guidance generally goes back to the state's guidance to them. So the third-party administrator is basing their guidance on the guidance from the state. So there seems to be, again, as a newer program, there's been some inconsistent and incorrect guidance to individuals accessing the benefit. Next slide, please. We asked the question as well, has your organization experienced increased overtime and extra help cost as a result of the implementation of the benefit? It's mixed bag in terms of those that are working with the state PLO program, a third and a third and a third. A third said yes, a third said no, a third were unsure. For the third-party administrator programs, the vast majority said they were unsure if it had incurred additional costs. Next slide, please. We also asked all the organizations that have are working with the Paid Leave Oregon program, what is the average FTE required to support leaves inside of their organization to administer the program? What we found is that for those organizations that have a third-party administrator and equivalent plan, their FTE headcount is a little bit over 1 FTE in order to administer the programs. And for the state PLO administered program, it's at least 2.5 FTE to administer the program. The range there is anywhere from 1 FTE to 4 FTE, depending on the size of the organization and the resources they have available to them. I will note that in the packet that you received, I received some additional information from a late responder in the survey, and so the data on this particular slide did change slightly. So the third-party equivalent administrator we had responded that had slightly more FTE than before, and so there is a change from what was provided earlier because I got updated information. Next slide, please. So we also took a look inside of our own organization, and we partnered with the county's budget office to ask the departments, what has your experience been in terms of have you incurred additional expenses due to employees being out on PLO, and have any services been impacted related to employees being out on PLO? Because we wanted to get a sense of what are those broader impacts based upon the leave program? Next slide, please. Next slide, please. Here we go. Excuse me. And so this is the feedback that we received from all of the departments and divisions that responded to this question. And you'll see that, expenses impacted, several parts of the organization said yes, or a few were unsure or to be determined. Finance, payroll was an affirmative. Technical services, health and human services, the CGRS, juvenile justice was a yes. HR was a yes. So other parts of the organizations did not experience it or were unsure. So tax and assessment, public works were a no. The sheriff's office was non-determined. Administrative facilities also non-determined, and the DA's office was no. We also asked, what kind of service levels were impacted. This was a little bit more clear, where most parts of the organization that responded to this survey request had experienced some sort of service impact as a result of the leave. And this is a point that, we want to send a signal that leave is absolutely important, and we want people to take advantage of this important benefit. And we also recognize that there is an impact on those that are left behind in the organization and picking up that additional work to maintain our services for the people that count on us. And so this is just to help show that this is a broader picture than just those individuals who are taking the leave.
I'm going to ask a question about that, though.
Sure.
This is not, the discussion is how to administer the plan. So that question isn't really relevant to that. That wouldn't change whether we were participating in the state program or doing a third-party administrator.
That's correct. We're still going to administer the benefit. It's just from a broader wellness perspective. I try to look at how do benefits impact the whole organization, the whole system, and just acknowledging that the paid leave program is an excellent benefit, and a lot of people, once they receive the benefit, I'll share more in a few slides about how it's benefited them that have taken it. But we also acknowledge it's had a significant impact on those folks that are picking up the work after. For those folks who are out on those leave.
There might just be a little bit, though, of expense related to the administering of the plan that might be a little bit woven in here for those areas that administer the plan, which would be payroll and HR, potentially, right? That they have actually, that difference in FTE that you saw on the prior slide where state program is having to hire a little more FTE than the ones with TPA. So I think a little bit of it's woven in here, but otherwise.
That's true, and we did capture that in a subsequent slide.
Okay.
So, we've got two leaves staff that about 50% of their time is devoted just to PLO, and then we've hired extra help in HR, and extra help has also been hired in payroll to deal with the additional workload with PLO. Next slide, please.
I'm sorry, Jared, if I may, just a clarification on that. You say additional help has been required, not part-time help. Is that for the administration or for the filling in the work?
It's definitely for the administration, but there's also, we believe, also additional help that's been hired as a result of people being on leave. But that is really not a new thing. That's always been something that we've had to do.
Regarding the administration, we saw the slide that the average is 4. Are we at 4? Is that right where we are?
Oh, the average is 2.5. 2.5. And we're at 2.5 in HR. If you include the additional payroll, I believe we're closer to 3.
I'm sorry, the range was up to 4.
Range is up to 4. Yep. Okay, on this slide, what we've tried to provide you with are estimated administrative costs for administering the program. And so we looked at, we have a team that meets on a regular basis from legal, from budget, from HR, from finance and payroll to deal with all the various issues. And we estimated that at about $15,000 a month and about $185,000 a year to administer the program. So this does not include the payroll staff, and other staff in HR have been significantly impacted with just general administration of The paid leave benefit is complicated, and there are a number of changes, and as payroll comes up, they've needed to make corrections to a number of folks' time cards. And so just acknowledging that there's been a significant amount of administration going on, and every time there's a change, we need to figure out how do we administer this change? How do we make this program work? We do believe that there's been increased overtime and extra help costs across all the various departments. Again, we've spoken to that's cost of doing business in regard to leaves. And also note that we believe that there are some significant opportunity costs associated with implementing this leave. As you notice, this is a benefit that impacts 6% of our employee population, and it's an important benefit. A significant portion of my small division in HR is devoted just to leaves. And when you put that in the context of the larger benefit profile, where we have 4,400 lives that we are working to help manage the benefits for those, we have a much larger footprint in the management of the leaves program as compared to other benefits that we have at the county. And there are things that we can be doing. I receive concerns all the time about things like communications around benefits, about people not understanding their benefits. We have people signing up for things that dependent care that have no dependents. We have other people that have dependents that are not signing up for dependent care FSA benefits, flexible spending account benefits. There's definitely a lot of work that could be done to help the organization better enhance our very generous benefit program that we have available to our employees. And we simply do not have the resources to devote to that sort of work. And so organizations need to make choices about where you spend your limited FTE resources, and just acknowledging that the leave program, because of its complexity, because one individual issue can suck up hours, if not days, of work for a staff member, it's a significant cost to the organization and what we could be doing if we had more resources devoted to other benefits. Next slide, please. Wanted to share with you information about the counties and employee contribution to the Paid Leave Oregon program. So as of 12/8/23, the county had contributed $1.3 million into that benefit. That's money that had been collected starting in January of 2023 through the date that we shared. And then the box below shows the employee utilization as of 12/8/23. The financial cost of that was a little bit over $500,000. So what that is showing you is that 6% of the Lane County employees that have used the benefit have used 41% of the accrued benefit in 3 months. Next slide, please. So I also shared with you that we did survey employees, and we've been talking to employees about the benefit, and we have received a number of very positive comments about the program from a number of employees that reported that they had no problems accessing the leave benefit. We definitely have a mixed bag you'll see in the subsequent slides of the experience of employees, but did want to share that when we did survey employees, there's a number of employees that had no problems at all. They filled out the online system through the state, had no problems with the administration application. They shared with us they had no problems. They received their benefit on time. And also wanted to share that there has been an expansion in the number of individuals that were able to access leave as a result of this law being put into place. So about 30 employees, or about 1/4 of the total individuals who participated in PLO, gained access to leave who would not have had access to it previously. 5 of those were new employees that would have not had access to leave under the previous leave programs, and 25 got access through additional leave that was granted for baby bonding. So those individuals had already had leave but had access to a new bank because of the way that we shifted our leave program. Next slide, please. So I shared with you that, it's definitely been a mixed bag in terms of feedback that we have received from employees. So we have received positive feedback, as I just shared with you. We've also received a large number of complaints about the program that have come to us. I would say, looking at the lion's share of the information that we have received, it's about 2 to 1. We've received more complaints than positive comments about the program. So a number of employees have expressed frustration with the administration and application of the program. So one employee stated, both my spouse and I were out on PLO. He was so sick that the process with the state was so cumbersome that had I not been well enough to help him, he would not have received the benefit. A number of employees talked about how difficult it was to get a hold of someone to talk to. Another individual said, the process seems so difficult that it seems like this program is trying to discourage people to apply. So these are comments that are made by employees, to be clear. So another employee said, there was no guidance on how to amend my claim. When I had to amend my claim, I could not get a hold of the program to find out information on how to do that. Another employee shared that, PLO was still asking them questions as they were literally preparing to go into surgery the next day. Another area that employees have shared their concerns about the program with us, employees reporting that they had received no PLO, paid leave Oregon pay, after the leave was approved and started. So, for example, several employees have said that, there have been many cases where they have started their leave, ended their leave, come back to work, and they'd still not received a payment from the state for their leave that they had taken. Another area of concern reported by a number of employees is around fraud and proof of identity. One employee said that, their claim had been suspended. They said that they were missing 2 full paychecks. They've called many times. They had been escalated to a manager. They still had not heard back after several weeks of trying to get information from the state program about the state of their leave. Another employee had been following the process. The state contacted them. The state has actually contracted, I believe, with a third party to administer fraudulent issues that come up with the program. And he had been trying for weeks in order to access his leave. He went through a number of different hoops to prove his identity, things like taking a picture of himself with his ID card, sending that in, following all the steps that the state had asked him to do. This particular employee contacted our office to see if there was any help or if there's anything that we could do or help them. We verified this employee had done everything that the state had asked them to do. We attempted, as the employer, to contact the state to vouch for this employee and say this employee is indeed who he says he is. Please grant him the leave request that he has asked for. And the state responded, I'm sorry, you have no ability to influence this. And so he eventually did get his leave granted, but it took 6 weeks of going back and forth with the state in order to get his leave granted. And what is frustrating for us as administrators, as employers, is that my staff, all of the management team, the payroll staff, we care deeply about our employees. We want them to have good benefits. We want them to have a good experience. And it is very difficult to hear complaints from employees, and we feel powerless to help them. So with other benefit programs, if an employee has an issue, we have an account manager. We have someone we can go to escalate the problem and get it resolved. As a recent example, we had a problem with our HSA contributions going to Optum Financial. So my staff and myself, we all got on the phone. We made calls to those account managers. It was escalated to their senior management team. The issue was corrected the next day. We have no such line to get these sorts of matters corrected with the state.
I know we got a little delayed with all the hiccups, but I'm just checking because we had, and maybe we don't need the 40 minutes we set aside for board conversation. I don't know, but I'm just checking on time.
Okay, I'm sorry. I'm flummoxed with all of the change, all of everything.
It's been really challenging. So I'm just asking. We don't, I don't know, but we had just budgeted 20 and 40. If we're flipping that, that's fine too. Just checking in for your time management.
And I'm sorry. This is my first time doing this
You're
sort
doing
of thing,
great.
and I apologize. I'm not used to this yet. I will try to speed up. So I just want to share with you this last concern here on this is that there are individuals that are saying that they're unwilling to apply for PLO because they're concerned about the financial impacts for themselves. We have heard a number of employees that have called us and said, I need to pay for my rent. I have to pay for my bills. I can't afford to not be without pay, so I'm going to avoid the Paid Leave Oregon benefit. Okay, next slide. So just high level, just some of the ongoing management concerns we just wanted to share is that we continue to be concerned about staffing, fraud, lack of service. Our inability to contact PLO is an ongoing concern for us. We are concerned that, we had to make a policy change that allowed people to take TM while they're waiting for PLO. Our philosophical stance around PLO is that we want people to be 100% whole. However, what this has done is that it actually creates this incentivizing of leave in some ways, because you have individuals that because they're getting paid TM and then they also get the PLO payment, they're essentially getting double paid for that time period. We're concerned about lack of intermittent leave flexibility. The state only allows for day-long increments. And we're also concerned about other things we've talked about: reporting, documentation, customer service, and just the loss in trust in the county's ability to influence this program. Next slide. Just real briefly, as far as we know, so the PLO program, the Paid Leave Oregon program, did update their salary caps from about $139,000 to $168,000. This does equate to a rate increase for the organization. There are no projected legislative actions planned for the 2024 Oregon State Legislature as far as we know. Next slide. And so at this point, the staff would like to recommend that the board reconsider the equivalent plan option. We are prepared to come back on February 6th with more information. We have information around reviewing a fully insured or self-insured option. And we do have some financial approaches to have how we could make that transition. And Christine, is there something you'd like to share on this particular point?
Did you want that detail now, or just that we would come back with it?
We can come back with it. What I think it's up to the discretion of the chair and the commissioner.
My vote's details good.
Excuse me. Thank you very much for that presentation. Appreciate it. We do have some time set aside for conversation, and I think we'll go a little more in depth. My sense is we do want to bring it back for more of that conversation. So yeah, Christine, if there's something you want to offer now to help us think about that recommendation, otherwise I think the detail when we come back for a decision is where that's going to fit in.
Sure, yeah. I could just briefly, we have a quote for the fully insured from the standard, so we know what that would look like. The 1% that is paid to the state obviously would transition to the county collecting that. So the county pays 0.4% of salary, employees pay 0.6%, so we would have those funds available to fund it. There would be a little bit of difference, it appears, at first, just based on our utilization. So a few $100,000 more is anticipated in the first year. We, as the board is well aware, we manage up some of our benefits internally, so we have reserves, lots of them long-term reserves. We're smoothing benefits, so we have available to us reserves if we needed to tap those. So the piece is that there would be no additional cost to a department in their budget next year, so you would not see an impact coming to you through the budget saying this is because of PLO. We would well be able to smooth that impact of a transition.
I'll open it up to the board for questions. Commissioner Buck.
Just along those lines, so we wouldn't want to see a budgetary impact per department with a change, but we would still have to be using reserves, so it's not a no-cost change scenario.
Correct, at least in the first year. Because as you saw, the state started charging the tax in January, and then the program went live in September. So they built reserves in order to smooth the impact over time as well. We were not able to do that. We have not set anything aside. So we would have to catch up just a little bit.
And how many years would you estimate it would take to catch up?
we would have to see if the utilization stayed the same. I mean, there's some thought about whether there was a pent-up demand, people knowing that PLO was coming in September, so it's hard to say whether our utilization would continue to be the same. So we would really need a little more experience.
If I could just add to that too, I think that, this is a new benefit. And so when you think about benefits, you want to think about, fully insured option is a way to outsource the risk associated with that. But that isn't a forever sort of decision. You can always bring a benefit like that back in-house, where we are controlling all the funds and in the driver's seat for those funds as well. So any decision that the board would choose to make, you could go with one to outsource risk initially and then potentially bring that risk back inside once the program has stabilized and we have a better sense of the utilization longer term.
Comments from Commissioner Farr?
Thanks. There's no finger pointing
Sure, your mic is
down here. Thank you. I remember the discussion we had regarding the decision to go with the state as opposed to going with a private insurer. And I remember very clearly the presentation that was made and the decision that was made. But it's clearly evident that we need to make a change. I'm looking at the staff's recommendations. I don't have any questions regarding the cost of it. I mean, it's as I said earlier, it's kind of I hate to use this term, but it's a cost of doing business. We want to provide the leave, but we want the employees to have the access to the leave. What I envisioned is that they'd have paychecks about the same time that they've got their paycheck. And it sounds like they're not getting paid in months. So, end of my discussion on that. I think I look forward to the next discussion as to how we move forward. And James, you're suggesting that if we do go to an outside insurer, that's not a permanent fix. Ultimately, in-house may be our best option. And in fact, in-house has been a wonderful option for other insurance programs that we administer.
Yeah, similar to, for example, with our medical benefits, we are self-insured as a medical benefit. However, we have Pacific Source still administers, at a very reduced cost just for the administration. So we could look at one solution for administering all of our leaves through one provider where we would have full visibility and the ability to support employees, that we could move from a fully insured profile where you have where you're paying a premium under a typical profile and bring all those dollars back in-house for the county. So that's how we manage a lot of our benefits, and it really makes a lot of financial sense for us to hold on to those funds. However, we are concerned about, the newness of this program and the utilization.
It's pretty mysterious to begin with, and making the decision for the state wasn't necessarily a bad decision, but because it was a little bit mysterious. We did have experience with previous state administered insurance programs that fell flat on their face, but that had nothing to do with this one. So the question that I have is, we have about a 2.5 FTE operating the administration of this currently. The average for for private insurance is about 1.4 is what it looks like. So there's maybe a 1.1 difference in the FTE. That money wouldn't go back into the savings, would it? That would just be redistributed through through HR.
Chair, Commissioner Farr, that is correct. Ideally, if such a change were to be made, we have, as you've heard James say, several other areas that we could repurpose that position to better support our workforce in other areas of health and wellness.
And what was the number, 4,400 lives that we are insuring.
That's correct.
That need more attention than we're already giving. And so the attention that's being given to this program could be redistributed to attention for those people. Okay, good. I'm fine with that. Thank you, Chair. Thank you.
I'm listening. Obviously, we had the individual conversations, and in these conversations, it just is very clear to me that this is something we need to make a move on and bring in-house. And temporarily, what Commissioner Farr said is going to a third party and then transitioning into our own thing, I think is a good plan. I'm just wondering why we need to wait. Why can't we make some sort of action today and move this forward down the road a little faster? That's my only question.
I think we're being asked whether we want to bring this back for a decision on February 6th. So that's what staff's looking for, that direction, and then they'll compile a little.
Chair Traeger, can I interrupt for 1 second?
Yes.
Can I ask people to lean forward into their mics when they're speaking? We're not picking up people who speaking. I can hear you faintly. So just if everyone could lean forward. Thank you.
Thank you. Procedurally, that's what staff's asking for direction. This was noticed as a work session so that staff could get direction whether we want to have them come back for an actual decision, which will bring us a little more focused information for us to make that decision, because there will be some variations in that decision. It's not just sort of a straight up. I mean, we could give a direction to make a change today, but we still need more information about what the nature of that change and the timeline and so on. So that's why, procedurally, why this is what we're doing today, and that's what we could do. Is that right?
Chair, Commissioners, that's correct. Our direction over a year ago was to come back with an update and to let the board know how things were going. That's what we're doing today, but also with the feedback that we've been given, wanting to just put out there that option to come back as soon as possible. And the schedule, as you all know, with very full days with the board, the soonest we can get back on the schedule is early in February. But we will be ready. We also wanted to be able to hear from you if you had questions about information that would help you with the decision, that the staff would have time to prepare that information and make sure that our next meeting was very fruitful in helping inform you on the decision that you will make.
So that, Commissioner Seneca, did you want to hop in?
Yeah, just real quick.
Yep.
Well, thank you, and I appreciate you guys taking the one-on-one time as well to get some of the stuff ironed out before the meeting. And James, it's a great presentation, and a year in, I think we see that we could make some changes, and I appreciate looking back and with this new information and seeing exactly where we are at. If we're paying for it and the employees want to use it, I mean, the thought of them being months without is kind of daunting. So whatever we can do to utilize this and get a stable paycheck, I think is definitely the direction we need to go. So thank you guys, appreciate it.
Commissioner Farr, did you want to add something?
Only to state this, Chair, that your presentation was very thorough. I have no further questions. I think you've done, James, a superb job of making it graphically easy to understand, and well done. I think I'm ready for the next discussion personally.
Great. Now I have a couple of questions, and I also, great presentation. Really appreciate the one-on-one briefing. I think that was, and I may ask for a follow-up in advance of our next conversation. I also just want to say your 2-to-1 complaints versus kudos on a program. That's, I think, better than what we get as a board generally overall in terms of, right? I mean, we know people are much more likely to pipe up when something isn't working than when it's going well. So there's that. I know during our one-on-one, you had indicated that generally, while the state program has, to put it mildly, had some hiccups in implementation, the trend is toward improvement, was what I recall you saying from our one-on-one briefing.
Yeah, thank you, Chair, Commissioners. Yes, we have seen some moderate improvement. It's hit and miss. I mean, clearly there have been some backslides recently. I mean, last week people were reporting to us they couldn't get through. So
last week.
Right. So there definitely it's a mixed bag. Yeah. Tried to really convey that this is a mixed bag of experiences that we've heard about.
Yeah. And we can dig into some of this more when we bring it back, but I also think it's important if we go back to that earliest slide with the timeline. While it's been a year since people have been contributing to the shared pool at the state level, it's only been a handful of months since people could apply for benefits. It hasn't been a year of testing the program, really. And I know we heard from Director Gray in the context of another work session when this came up, I think in our budget kickoff, that there was I think probably a correct assumption that the high utilization was largely sort of pent-up demand. I know all of us, right, we with our regular health insurance, right, we tend to group things in a plan year to take advantage of meeting the deductible and so on. So I think because people knew this program was going, there may have been some delayed care waiting for people to be able to use this benefit. So I think I think there's likely some trends that are going to just sort themselves out in the wash in terms of utilization statewide, not just, and Lane County will be no exception in that regard. I do think it's also really important, your story was really compelling, James, about the employee who couldn't get their replacement check in time and was worried about paying rent. And I think what I know from my years of advocacy and working on this program is that's why we needed this program, is too many individuals were having that exact experience for having to take leave without pay for life events that this now covers. So there's a cost to not having programs like this in place. That's why we finally got this at the state level. And really the ultimate fix to a sort of perfect program is a universal program, right? That's the problem. We are part of the mix of shifting, as the final holdout of developed nations on the planet of having a universal program, because everybody experiences illnesses and injuries and welcomes new kids into their lives at some time and in some way. And so we're just sort of on that trajectory of that much needed change. It's a new and ambitious and long overdue program. We were not offering this until the state said offer it, but that doesn't mean our employees didn't need it. So I think what's going to be most important and useful, it sounds like it is the direction to bring this back on the 6th, is to stay very focused on the relative merits of shifting to a different form of administering the leave versus participating in the state program, and not the merits of the benefit itself, because that's been established and it is the law, and we will be providing it for our workers. And so the conversation really needs to stay focused on that for me. And I would also like us to hear if there are ways we could increase or improve the benefit by bringing it into a third party or in-house. So, for example, that issue you said about intermittent leave, that it's a function of the state program that requires a full day, if I'm understanding you. Is that something we could adapt to be more flexible and accommodating? So I would like to hear some of those. I'd like our conversation to focus in that way. And I think that is what I have. Did you want to respond?
Chair, Commissioners, if I may, just in response, I absolutely agree. I don't think there's any disagreement of the need for this policy direction and where the state went. We have, employees, they're human beings, they have families. Things happen that are not planned, sometimes catastrophically. People also have need the ability to care for other family members, and it is heart-wrenching when you hear employees being so concerned about how they're going to feed their family or pay their rent. And certainly a program like this moves us in that general direction. Now it's about the fine-tuning, and we will definitely come back with the focus. I don't think there's any disagreement on the need for the program.
Great, thank you. And I wasn't necessarily hearing that from anyone. I just wanted to make that really clear. And
yeah, I just wanted to bring up, my name is Sherry Sanders, and I'm the Senior Leaves Analyst here at Lane County, and so I'm in the trenches with the employees. And you're concerned about some of the components of the Paid Leave Oregon plan, carrying that forward to whatever you all decide when we meet again. We would be setting up an equivalent plan. And that would mean that our equivalent plan would have to mirror the same standards and rules that Paid Leave Oregon has. So if you're concerned about intermittent leave, we would still be offering intermittent leave in one-day absences with the equivalent plan. So for us to get approved by the state, we would have to show that our plan would be the same plan that is set up currently with the Paid Leave Oregon. It would just be administered by the standard.
And we can bring more back to discuss at the next.
Exactly. Yeah, I see Commissioner Buck wants to get in the queue, but I'd want to make really sure that it is, I understand what you're saying, but how that's different from something that says, this is the baseline is an equivalent plan, but that we don't have the opportunity to do better is surprising to me to hear. So
Thank you, Chair and Commissioners. Just wanted to make it clear that, we do have an expectation that customer service would improve by a lot with the standard. And also, our goal has always been for people to be 100% whole. We are all aligned on the purpose of this benefit. And so how do you get people there faster and more efficiently and make sure that they have what they need to help their families?
Yeah, I understand that. When we met, the visibility into the program is one of the biggest challenges for us to be advocates for our workers to get their due benefit. And so that's really important to me as well. Commissioner Buck?
Thank you, Chair. I used to be a third-party administrator in a past life. And so I understand that they're very good at their individual specialty that they're going to be providing. And they're experts in this particular field, which is helpful in a variety of ways. So I very much appreciate what they can do. It doesn't come without an administrative cost, of course, so we just have to be aware of that. But it's a cost internally as well. So it'd be nice to know, financially speaking, how much we would save in that direction. Should we go with a third-party administrator, which I kind of anticipate we may, I would want to know if they're able to get through to the state for questions and answers any better than our own staff, because the increase in efficiency and productivity and just getting people their paychecks faster does really lean on their ability to be able to communicate with the state in a more effective manner. And if they have enough clients, I think that's the way that it would generally work. But if they're on hold with the state, just as long as we're on hold with the state, it wouldn't change that particular situation. So I would like to eventually get feedback on these same questions under a different scenario and be able to reevaluate and see how effective it could actually be.
Thank you. Please.
Thank you, Chair and Commissioners. Yeah, absolutely, and we will be able to get that level of information. The good news about the Standard, which is the organization we're currently partnered with, is, they're headquartered in Oregon. They have significant resources here. From our benefit broker, we do understand that compared to other third-party administrators, because they do have a significant presence in Oregon, they understand the Oregon plans much better, and so they have been able to address a number of these issues. But we will absolutely be able to follow up on those sorts of questions.
So I just wanted to help me out here if this is correct, but my understanding of if we were to switch to a third-party administrator, we would follow the state rules and guidelines for the program, but we would hold the funds. And then the third-party administrator that we contract with would disperse those funds, correct? And provide all of that. So it really...
That's correct.
Yeah.
Instead of the state paying the employee through PLO, if we went with an equivalent plan, the Standard would be making those payments to the employee. If we brought it in-house and did a self-administering, after if we made that decision to have them fully insured and then went to self-insure, we would then get the information that the leave was approved, and then Lane County would pay the employee with our regular payroll.
So this is all to say that we would have more control. In a lot of ways, we would just be cutting the state out. I think we knew this going into the program, that typically the state government, and this is not to be critical of the state of Oregon, every state, the government closest to the people governs best, right? So state agencies tend not to be the most responsive to the local needs. The local agencies tend to be the most responsive. And so, that would be how we would structure the program, is we would have more control over it. We would be able to work with the Standard closely, answer the questions, distribute those funds, and we wouldn't be reliant on the state.
And yet we would face some of the same challenges because of this equivalent, these issues around stacking of leave benefits and so on. That when we talked about in our one-on-one, those are still legislative fixes that are required to the sort of, to the state program in order for our equivalent program to be able to reflect that, right? That's not something we can fix by bringing it in-house. We're really looking at better visibility into the administration, which means better customer service for our employees, which means more timely fulfillment of claims, and some cost savings for us because of the cumbersome nature of trying to administer it through the state program. That's really what we'll have a different layer of control over.
Chair, that's accurate as far as I know right now. However, we will be having more conversations. If there are places where we can enhance the leave benefit, we certainly will attempt to do that. And also just recognizing this is a both and strategy. We can bring this benefit, and have it administered by a third party, and then eventually move to that self-funding strategy, and still work to influence the legislative direction so it's better for everyone.
Great, thank you for that. My last comment, and then I'll call on Commissioner Farr, is, and I assume you would anyway, but were there to be any impacts on bargaining to making a shift like this? I'm assuming because the benefit is the benefit is the benefit, not the administration of it impacting that, but that would be good for us to hear when this comes back to us for a decision as well. Commissioner Farr.
Thank you, Chair. And you hit the second to last thing you talked about was exactly what I'm most interested in: customer service, making certain that the employees are paid as quickly as possible. The delays are unacceptable, and to me, that everything else is kind of a wash. But that is the bottom line: is when are the folks getting paid for their earned leave? So and James, you mentioned customer service at least 3 times, and Steve Mokrajski, you mentioned customer service at least twice. That's what it's all about. Is making sure the people that we serve are getting served as quickly as possible.
So I think unless there's any other comments, what you needed was direction as to whether we wanted you to bring more information, more focused information back for us to make a decision about administration of the plan, tentatively February 6th, but agenda team will do the sorting finally. And it's also my understanding that if for whatever reason we don't hit that mark, quarterly is the timeline we're on to make changes. So as far as the sort of jumping in on the jump rope that's already turning, we have a bit of time. Okay, great. Is there anything else for today for the good of the order? Then I will adjourn us until our next regularly scheduled meeting, which is Tuesday, January 30th. We're adjourned.
Thank you all so much.